Thank you all for joining me here today. I know this is not a typical press event. Some of you will be watching from Facebook Live due to rules regarding social distancing and in-person reporting, and I recognize and appreciate this. This will be the first of several media briefings as we move forward in our community. By conservative measurements, I've had over 100 interviews since this started a couple of months ago, and we'll continue to communicate because that's one of the roles of county government, to monitor, to communicate, and then to respond. These 3 times a week media briefings will not be a substitute for one-on-one interviews. I'll continue to make myself available to answer questions whenever possible. Communications is an important part of the role of county government, so our citizens will understand not only what their role is in this pandemic, but what role the county government is playing. I understand that everyone at home, anxieties are high. That's to be expected. We hope that part of our strategy with communication will help manage those expectations. Yesterday, I spent the holiday with my family, talking about where we were in this challenging time and our path forward. Everyone is stir crazy, and we understand and respect that. As the days get longer and warmer, everybody wants to go outside, and that's to be expected. But we have to recognize that although our community wants answers, when will this be over? When will we be back to normal? We don't have those answers. We know it's not tomorrow. We know it's not next week, but we know that we are moving forward. We know that there is a path forward, and we're all working together to get there. St. Louis County is going to be and continue to be fully engaged in responding to this pandemic, working very closely with our regional partners, our other local governments, health systems, other public health agencies, not just with the public health response of this pandemic, but also the humanitarian response. St. Louis County will be making this week a significant investment in testing materials and supplies. For the past 6 weeks, it's been extraordinarily difficult for our hospital systems to purchase testing supplies because of the national shortage. The testing environment definitely makes it more difficult to respond to this pandemic. We are managing that through that as well as possible, but we understand that an improved testing environment is an important part of the recovery phase as we start to consider what the future brings in the next 2 or 3 weeks, and when we can start to have a conversation about relaxing our restrictions and social distancing guidelines. We understand that the tests have to be distributed in an equitable way. The tests are made available based on symptoms and history of chronic medical problems. We understand that a history of chronic medical problems disproportionately affects our minority communities. We understand that poverty runs in parallel with our minority communities, and we respect that. That's why we've directed our resources several weeks ago to respond in an equitable manner, even before our zip code maps showed us what we already expected to see. Tests are an important part of our economic revival. We understand that part of improving our economy, the third part of this crisis is the economic crisis. Part of improving that is making sure that we have a robust testing environment, and our public health department will be working very significantly to participate with that in the coming weeks. As we've heard from Dr. Garza in his briefings from the Metropolitan Pandemic Task Force, the hospitals are there to treat people who are sick. They can't prevent people from getting sick. That's why our role as individuals is so important. Social distancing is the cornerstone of the treatment for a medical problem that doesn't have a cure and doesn't have a vaccine. What we all do as individuals will determine our path forward. Social distancing works. Washing your hands with soap and water works. Staying away from people who are sick works, and staying home if you're sick also works. We also have to recognize that up to 30% of the transmission of this virus is between asymptomatic people or people who have so little symptoms that they are not recognized. That's why it's important that we adopt strategies to wear masks, cloth masks when we're out in public, when social distancing will be difficult. But please recognize that we also need to save, whenever possible, our surgical masks and N95 masks for our healthcare professionals. We understand that this virus has created hardships. We respect that. We can't let our guard down. We have to be vigilant moving forward. We have to do everything we can to prevent the spread. Again, we are dealing with 3 crises, not one. We have a public health crisis, we have a humanitarian crisis, and we have an economic crisis that follows in large part due to the social distancing, lost time off work, and restrictions on our movement. We're moving forward to address these in unison. We will soon be discussing the federal stimulus relief, the process for St. Louis County to move forward with that. We understand that we are eligible as a county for up to $175 million of federal relief to be spent on COVID-19 related expenses. Those will fall into the 3 crises: the public health response, the humanitarian crisis that follows, and then the economic recovery. We will be working closely with our regional partners, our regional jurisdictions. We have great working relationships amongst the leadership. The public health response and our humanitarian response now crosses jurisdictional lines, and we're working very closely together. I'd be glad to take any questions either here or through our email to our communications director. Yes, and we'll go to Jim.
I know you said you can't predict when this is going to wind down, but is there a time frame when you're hopeful, number one, that we might be able to see a light at the end of the tunnel, and number two, on the social distancing, and again, do we have a kind of a timeline for when you're thinking there might be some relaxing, perhaps an extension of the stay-at-home order? What are your thoughts on those areas?
Well, I'm hopeful that the decision on the stay-at-home order will be made together, working together as a region among the community leaders. We'll be talking with our hospital systems, our public health experts. We're watching very closely the case counts, the hospital admissions, the ICU admissions, and their capacity. In order for us to relax social distancing standards, we need information that we don't currently have. And without that information, we can only recognize that we would like to consider doing so in sometime in May. I would expect that we will, like the mayor spoke last week, I would expect that we will talk about an extension of those social distancing orders, but to what time period or what date, I'd like to make that decision together with the other regional leaders, with our experts in public health, and with our hospital systems. We need to make sure that we are able to manage the capacity in our hospital systems, which means everyone in our community is fully engaged and respectful of our social distancing requirements. We need to have better testing capabilities in our community because test, isolation, and quarantine of close contacts is an important part of this recovery. So we need a few more pieces to be in place before we move forward, and we'll be watching all those variables very closely. Jeremy?
First, ask my question, but essentially, as you open the county, once you make a decision to start opening businesses, what is that going to look like? Is it going to be in stages? Or are we going to see crowd sizes? We went from 1,000 to 500, whatever it was, to 10. Is it going to go gradually down?
Well, I thought our reductions here in St. Louis County, made jointly across our regions, were thoughtful and staged, and earlier in the process than most in the country. And I think that will pay dividends moving forward as we see the response to this virus. But I would also expect that relaxing and social distancing won't be a light switch. We've heard that phrase before. This will be stepwise as we watch the case count, as we watch the compliance with social distancing, as we watch our ability to test robustly in our community, that these will be staged. But what that looks like, again, depends on information that we don't have because it's not yet available today. What does a case count look like? How is a hospital capacity? How are first responders, doctors, and nurses who've been affected by COVID-19, how are they recovering? Do we have enough individuals available to take care of people who are sick? And what is our testing environment like? Yes.
You mentioned a significant investment in testing supplies. Is there a number at all as to how many tests are expected this week, or any type of number?
Well, we have been slowly increasing testing ability throughout St. Louis County and throughout our region. Our hospital systems have led this effort, I believe, very heroically. They have great resources. All three of our main hospital systems, perhaps all four of them now, have the ability to test right here in St. Louis County. And they are slowly ramping up their testing capabilities depending on their ability to purchase testing supplies, which is a national shortage that we are competing for with other states and other communities. We have tests through our hospital systems that are available through phone numbers on our county website. There is a federally qualified health center in North St. Louis County that is performing tests. There are several FQHCs in the city of St. Louis who are performing tests now. Total Access Urgent Care performs some tests. Quest and LabCorp perform some tests when ordered by a physician. And the Department of Public Health, the St. Louis County Department of Public Health, is doing some testing. We're focusing on high-risk populations, nursing homes, our jail, public health workers, and then patients who are in our Department of Public Health, who come to our Department of Public Health for care because they are uninsured or have limited access. We will continue to expand testing as we're available to purchase testing supplies over the coming weeks.
Do we know how many tests might be coming this week?
No, we will purchase them as quickly as we can. We can watch the number of tests that are being performed statewide and locally through the dashboard on the on stlcorona.com, St. Louis County's webpage, and the number of tests that are being reported through the state. We are, as a state and as a community, becoming more proficient at reporting data. Our first effort, of course, in this public health response has been to save lives and to produce data as promptly as possible along with that. We are, I believe the state now is starting to report the total number of tests, positive and negative, which helps us. We'll continue to see refinements of the data that we're producing moving forward.
Well, when you say a significant investment in testing materials and supplies this week, I'm presuming you mean more tests coming to
St. Louis County is prepared to purchase several $1 million worth of tests in the coming weeks to supplement what's happening. We will work with our regional partners to make sure that testing is available widely in our community, our regional jurisdictions. We will be working with our health systems, with our FQHCs. We will make sure that the tests are available as broadly as possible, given our ability to purchase those. We expect that ability to purchase those to increase over the coming weeks, and that will be an important part of our recovery process. Yes, Jeremy?
How many tests is several $1 million? How much are they per test?
On average, depending on the type of test, probably $15 to $25 a test. More of them on the $25 range. Again, we don't expect those all to arrive within a week. We expect it to be rolled in and staged over time, and we will be competing with other parts of the country to purchase those as our country ramps up the production of testing supplies.
Are there any preparations in place for when it comes to a mass number of bodies for St. Louis County?
I think we have to recognize that anytime you have a tragedy like this, that loss of life is a part of it, and we need to be very respectful about how we communicate that with the individuals who have lost loved ones, and make sure that they have the ability to grieve and mourn properly, and that we respect the dignity that is involved in loss of life. One of the roles of St. Louis County is to operate the medical examiner's office, and we do that regionally. We have relationships with our surrounding jurisdictions where we provide medical examiner services for them as well. We can see what's happening around the country. We don't expect to see that magnitude of loss of life here in the St. Louis region, but we do expect to see more than we're used to, and we're making arrangements to manage that. We will work cooperatively to manage that with our surrounding jurisdictions. We expect, and we will be prepared with a temporary facility if we need it, because we think that's important to make sure that families who have lost loved ones in our community have a way to grieve in a proper and respectful manner. We've been working very closely with the Interfaith Coalition here in St. Louis County. We've had discussions with them about what the proper and respectful and dignified way is to manage loss of life in our community.
Sam, we lost, St. Louis County announced tragically 9 more deaths over the weekend. Is there a message that you have this morning for St. Louis County residents who might be fearful, might be concerned as these numbers continue to mount? What do you want people to know out there about the situation? What's important here?
I think it's important to recognize that we have a plan. We've been working on this for a couple of months now. We watch what happened around the country. Our hospital systems are working together in a very cooperative and efficient, coordinated way. I'm very, very impressed with the way they've come together, the way they're managing their resources, the way they're communicating what's happening in the health systems, that this is a serious problem. We have to understand that COVID-19 is a new medical problem that we haven't seen before. It's a new virus. There is currently no good medical treatment, and the best treatment is prevention. We also have to recognize that as a community, we've done this before. St. Louis is a very resilient community. We've been challenged before. There is a path forward, and I am extraordinarily impressed with how our community is coming together, with volunteers sewing masks, with everyone stepping up in a very responsible manner in following these social distancing practices, because that is the key moving forward. That is how the world has managed this, and that is how our country has managed this. And there's been a lot of discussion in our community about enforcement of social distancing policies, but that is such a rare occurrence because the vast majority of people in our community understand this and get this and understand why it's important. And I guess that would be my final point, is we're in this together. Everyone has to do their part. Everyone has to participate in social distancing. Everyone has to recognize that this is going to be tough for a few weeks as we get through this, and then we start to relax this. But the anxiety is normal. It's expected. I think it's important that we talk to our kids, that we try to communicate with our family members through whatever technology we have available, that we keep those social relationships going. I spoke to someone yesterday afternoon who told me they had a happy hour Saturday night over Zoom, right? So I think we find new ways to keep our relationships and our social connections. It's a very important part of this recovery process. Any other questions? Jeremy?
I reported last week that there were positive employees at the jail, and there were 2 inmates that were showing mild symptoms. Do you have any update on those inmates, and are there any other further positive cases in the
There, first of all, I want to recognize the extraordinary measures that Dr. Doucette and Spring-Schmidt have taken in the jail to minimize the exposure of our inmates to COVID-19. The measures that they take whenever someone new comes to the jail, to screen them and quarantine them if necessary. The measures they are taking to keep our correction workers and nursing staff who may have been exposed away from inmates. The measures they have taken to improve hygiene and access to sanitizer within the jail. Those are extraordinary. We did have 2 correctional staff who were screened, who were positive, who were isolated and recovered away from the inmates in the jail. We had 3 inmates who were tested. All those tests have come back negative, and we have no one waiting a test result currently who is an inmate. But we have to understand that statistically, at some point along the way, despite the extraordinary measures we have taken, that someone who is an inmate in the jail may become positive. Either someone who is asymptomatic gets into that population, because we know that 25 or 30% of this can be transmitted by someone who is asymptomatic. So it's possible that an employee there may come in contact. And we're doing everything we can to limit that just like any close quarter setting, whether it's a skilled nursing facility or a correctional facility, we have to respect the ability of the virus to spread very quickly there, and that's why we've taken so many precautions in the jail, and so far those precautions have paid off. But statistically, at some point, we may end up with a positive inmate, and when we do, we have measures in place to treat them effectively and do everything we can to prevent the spread. We do have a rapid response team that is part of our Department of Public Health. So whenever we have a nursing home or senior living facility that has a positive employee or a positive patient, we move quickly. Within a few hours, we're there. We're testing everyone. We're providing them with PPE if they're short. We're giving them educational materials. We're moving very quickly to limit the impact of a COVID-19 within those senior living facilities, because we know how devastating that can be.
What is the status of the Florissant Hotel? I think it was supposed to be transformed into a hospital. The governor had said he wanted to see that maybe open this week. Is that still on track? Or?
Yeah, it's there's some minor remodeling taking place to make that a overflow for our hospital systems. I believe Dr. Garza may have mentioned that earlier. That is for patients who are not critically ill, who are either recovering from hospitalization or don't need to be hospitalized because they need some nursing care, but they don't need to be in an intensive situation. And we will have contacts with hotels. We have one in North County. We are finalizing one in West County. But we have to recognize that if we stretch our capacity of our hospitals, we may need a little bit of overflow, and that location in Florissant is one of those possibilities. Currently, our hospitals are able to manage the capacity. They've made extraordinary efforts to prepare for this, to increase their critical care capacity within their footprint, within their existing facilities and on their current campuses. And so far that's worked out. But we do have to have options in case there is any sort of overflow, and we're just preparing for that. We believe that the hotel facilities will be adequate. At this time, we don't believe we'll need anything more than that. Any other questions?
You don't think there'll be anything else besides the one in Florissant at this point?
I believe there's a West County location that we are preparing to have a relationship with. St. Louis County also has contracts for at least between 400 and 600 hotel rooms for patients who would need to be isolated because they were COVID-19 positive and they were recovering and they don't need hospitalization. We understand that up to 70%, maybe more, of COVID-19 transmission is within a household. So if we have someone who needs to be isolated and they don't have the ability to isolate in a room at their own house with their own bathroom to follow all the rigid guidelines of isolation, then we want to make a hotel room available to them for a short period of time, because stopping that transmission in our community is so valuable to us, and we want to make sure that they aren't passing it to their family members if they don't have the ability to isolate at home under ideal circumstances.
Where's the West County side?
The West County side I don't think has been announced, so I don't know. Yes, right. Yeah, the West County side is for overflow of the hospital systems if needed. And there are also relationships with St. Louis County for their piece of this puzzle, which is managing isolation and quarantine, isolation of known or suspected COVID-19 patients, and quarantine of close contacts while we wait to see if they develop symptoms.
Is that it? Thank you, guys.
Okay, thank you everyone.